And good afternoon, and thanks for joining us here live on Facebook. We are live from Adventist Health Bakersfield, actually talking about some of the issues that I'm sure are on a lot of people's minds these days when it comes to medical care in the time of COVID. I'm Kiyoshi Tomono. This is the Wellness Connection. Today, how do we talk about cancer care in specific in the time of COVID? Because cancer care is vital. It's one of those things, obviously, preventative-wise and treatment-wise, you shouldn't skip. So how do we make sure that people are safe when they come here to the AIS Cancer Center at Adventist Health Bakersfield? We want to answer some of your questions today. So before we get into everything, we do want to let you know that we are monitoring the questions as they come in live here on the 23 ABC Facebook page. So go ahead and ask away, and we'll try and answer some of those questions as we go. So joining us here today on this wonderful Friday is Dr. Francesca Haney, a board-certified general surgeon who specializes in the treatment of benign and malignant breast disease. So you're a breast surgeon. Dr. Haney, thanks for joining us.
Thank you. Thanks for being here.
Of course, Dr. Luis Mariscal, the medical director for Adventist Health's AIS Cancer Center, board certified in radiation oncology. Thank you for joining us as well.
Thanks for having me.
Both doctors here, part of our award-winning team at AIS Cancer Center. AIS Cancer Center, by the way, the breast center, the first NAPBC certified breast center in Kern County. And our Cancer Center program is now the first and only cancer center in Kern County to be accredited by the Commission on Cancer of the American College of Surgeons. So that is a unique thing. We'll talk a little bit more about why that's important in just a bit, but it is a commitment to providing comprehensive care all in one location at a very high level of quality, making sure that the patient is at the center of all of that care. So doctors, thank you guys both for joining me. So let's talk about this through this pandemic. Dr. Haney, let's start with you first. What are you seeing and hearing on the ground in terms of patient response when they walk in the door? Have they been afraid to come into medical offices and come into hospitals because of the fear of COVID?
So initially, when we first started with all of this, we were told by the American College of Surgeons and National Association for Breast Programs that a consensus statement in which they were trying to get patients to, again, quarantine at home, stay at home. And so a lot of things have been placed on hold, mammograms, breast exams, things like that. So now patients are being released to go back to get their mammograms, to come in and do their screening. And so we have patients who are happy to come back because they want to get their care. There's obviously a fear of going out, so we're trying to mitigate some of that and try to reassure people that doctor's offices can actually be some of the safe places that you can go if you need care. So we're actually starting to see people come back. Our cancer patients are happy to come back because they would like their checkups and things like that. So we're seeing that, and we're hoping to encourage people to get back to the regular screening because, again, this can be done safely.
And let's talk about that. Did you hear, at least anecdotally or from some of your patients, those who are afraid to go out and go get that mammogram, those who are afraid to get that clinical breast exam, those who are afraid to go get any kind of preventative services?
I think overall in the community, I think people were appropriate. They were doing what they were told to not get their screening. And so now as we see people being able to go back, we're seeing people come in for their mammography. We know that our mammography is being truly booked. They're trying to get all the backlog of patients in. So we're not necessarily seeing people be afraid to come in, actually. And I think people are very educated about how to go about to get their care safely, too. So I think people are really very smart about it today.
And let's talk about that, Dr. Mariscal. We're sitting a good 10 feet apart,
We're
which is not
distancing.
normal. We are like way apart. Normally, back when we
have masks.
We do have them here, but we're so far away.
We're socially distancing so that our viewing audience can actually hear us. So
yeah, and let's talk about that because when we were doing these segments with 23 ABC last year, we were sitting around a round table, probably within about 2 feet of each other. So when it comes to safety, in terms of what you're seeing over there across the street at the AIS Cancer Center, what kind of things are different? I mean, when you walk up, things are going to be a little bit different.
yeah, so early on, I mean, obviously this has been an evolving situation where we learn more pretty much, it seems like every day, and sometimes things aren't necessarily compatible with what we thought earlier. But early on, we instituted screening at the Cancer Center, so everybody coming in, both patients and staff, doing temperature checks. Everyone's being provided with a mask, and so our patients, everyone involved in care is in a mask, constantly washing their hands or using hand sanitizer. So, and we instituted that really at the beginning of this pandemic, and we've continued that and will continue that. And that's the first layer of really taking care of both our patients and our staff.
And is it different in the exam room? I mean, I know that we've got procedures and protocols in the hospital, like we're wiping everything down, we're keeping people farther apart.
So we always have, in radiation, we always have, pretty vigorous standards for cleanliness, but definitely we've kind of gone through that and analyzed, is there anything we can do even better? And so definitely every room is fully sanitized. With radiation, we use large machines and special vaults, and we fully sanitize that between every patient, and then do a deep clean at the beginning and at the end of every day. So definitely we're thinking about that.
And I want to ask something, and something Dr. Haney brought up and touched on too, is did cancer care stop during COVID? Did people not get care? I mean, I think there was kind of this perception that everything kind of just stopped, like restaurants were shut down, everything was shut down during the quarantine period.
So in radiation, we were actually extremely busy in the months of March and April. And the challenge was more making sure our staff was healthy and not overwhelmed, especially just the stress of the whole situation. But we were treating our patients as per normal with all those precautions. Now things have slowed down a little bit because things weren't being diagnosed at the same rate necessarily in the months of March and April and even May. And so, that's starting to pick up. So we're always a few weeks to few months behind, something has to be diagnosed before we get involved. So, but we were extremely busy during the peak of everything. So.
And I know one of the things that worries cancer patients in particular, for those who have never gone through cancer treatment, is when you get chemotherapy and you get some of these medications, is your immune compromised. Your immune system isn't working as hard as it potentially could if you're not on these medications. So is there concern for those patients who are coming into the cancer center?
So it's a balance. Cancer is not something that for the most part we can put off. And so that is the challenge. We have something that's very important to treat. And we're concerned about immune compromise. And so, but we have to balance that. And so there are some studies that have been done recently. The best study really from the UK, looking at over 800 patients, and they tried to analyze, did receiving chemo when infected with COVID lead to higher rates of death? And actually statistically there was no difference. So that is why you've seen recommendations evolving where recently the message has been, you need to get back into your cancer care because we're concerned. We're concerned that if we do delay things significantly, we are going to have worse outcomes across the board, especially in cancers that move quickly.
And I want to talk a little bit more about that in just a second. Dr. Haney, I want to bring you back in. If I am a breast cancer patient and I'm a mom, do I bring my kid with me to an appointment? Do I need to be concerned about that? Can I bring my spouse with me to an appointment?
So those are good questions. I have 3 kids at home, and so I know it's hard, especially with all the schools that close down and getting childcare and things like that, that a lot of times, you don't have an option. But I would encourage patients when you come to visit and you come for an appointment, really you're thinking about not only you as the patient being there, but also your family and what you're exposing them. So I would not recommend that you bring children. If you can find appropriate childcare, that you not bring kids with you. We do allow 1 visitor with you at the time for a cancer center. A lot of people are actually electing to not bring their spouse, but put their spouse on the phone during the visit, or FaceTime, and they'll always ask me, can I put my spouse on the phone to hear this? And that's totally fine. We live in a new age where we're going to have to adjust, and so again, thank goodness we have the technology where we can adjust to being able to do these kind of things and not feel that person doesn't have a support system. Even if they're not physically present in the room, they are still there with that person.
Yeah, I mean, that's one of the things I know that's been tough for so many. We just recently revised our visitor policy and think people are starting to come over to our hospital. We're allowing 1 visitor per patient. There's a whole host of other exceptions and rules and parts of that, but essentially 1 visitor per patient who is not positive for COVID or suspected of COVID. What is it like? I mean, it's because that's going to be a challenge for you as a provider. I know when we're asked that question, we're getting all kinds of questions from family members who want to be by their patient's side, because that's an important part of like the healing process, and in terms of family members being there to advocate sometimes for a patient that may not fully understand. That's got to be important to you as a caregiver too, right? Having the family member there is not a hindrance. It's usually important.
It is, but at the same time, we're trying to take care of that patient, right? But we're also concerned about the family member that's there. I mean, they have a risk for COVID. They're going to be with that individual, so there are greater implications for that. So yes, it's important to have your support system there, but again, with technology, we can adapt accordingly.
And Dr. Mariscal, what are your thoughts on that? On how do you, and let me ask this follow-up question too, is how do you guys stay safe? We talked about some of the patients and everything. How do you guys keep from potentially being exposed to COVID when you see that many people over the course of a day?
Yeah, so again, we have such a vigorous cleaning kind of regimen in our rooms for our staff. Everyone uses hand sanitizer before and after every patient. Everyone's in a mask. And so a lot of those things, other than the masks, are things that we already did all the time. And so masks are obviously somewhat of a hindrance. It's hard to talk to people. You can't see people smile. Mm-hmm. I have lots of patients who say they wish they could see my smile. And so that's a change. And you have to account for that. That's a change in the dynamic in your relationship with a patient and your physician. But while we're trying to balance all those things, we have minimized guests, patients, family to the one. If there's any question of if they have any sick contacts, we ask that they don't come into the building, because we're trying to keep all our patients safe. We're trying to keep all of our staff safe. If our staff gets sick, we can't provide care. So it really is a balancing act.
And so how do you, I think I probably know the answer to this, but for follow-up appointments, is there any reason you would tell a cancer patient not to be coming to the cancer center for regular care? When you outweigh letting cancer go for a little bit down the road versus treatment, is there any reason, maybe with a slow-moving cancer, where you would say, hey, maybe we can wait on that a little bit longer?
Yeah, so for some less aggressive cancers, we've done some measures to maybe bridge some time with a medicine that can keep the cancer at bay to buy us a little time. The problem with that strategy is we don't know when this is going to end. So if we're talking a couple months, maybe that's a good strategy. But if this continues into 2021, there's only so long you can bridge someone in that manner. On the back end of treatment, when we've treated the disease and we think that we're doing well, some of these follow-ups we're definitely doing by phone or extending out a little bit. We might still be getting some studies or blood tests or other scans, but we don't necessarily need to see the patient in person, and that helps keep them safer and also keep everyone at the cancer center a little bit safer.
Let me ask, is there a time frame you can delay treatment by, so to speak? Is it a patient-by-patient basis? Or?
It's really going to be based on the type of disease. Some cancers move very quickly, and there's really no safe interval to delay. Some things move somewhat slower and in a more predictable fashion, and especially if we can kind of control the disease with a medicine for a while, that is appropriate. But you can't just say across the board, yeah, we can delay it.
And Dr. Haney, let's talk about this, because I think with breast cancer, I would imagine, I'm not a surgeon, but I would imagine most of your work is very hands-on. And when we talk about self-care and self-diagnosis, is doing the self-breast exam, how important is it for women to be continuing that, and how important is it for them to be coming in? Can you substitute certain things in your practice, and then other things like laying hands on a patient are just absolutely critical in some cases?
Well, originally, when the pandemic first came out, the American Society of Breast Surgeons and the American College of Surgeons had asked us not to operate for a couple of reasons. So patients who had early cancers, who were hormone positive, were placed on anti-estrogen medication, and that's able to treat the cancer and keep it at bay. And then we were given the go-ahead to go ahead and start doing surgeries, which was very much a relief to patients because they had cancer, and so they want to get the cancer out. We are encouraging patients still, part of the self-care of being at home is you can still do your breast exam. That doesn't require anybody, that's just you. Your clinical breast exam, either your gynecologist or your primary care provider, if you're going in, can still do that. I have some patients who they were delayed from their mammogram about 3 months. That really shouldn't make that much of a difference. So to reassure people that as you get back into screening, the delay is probably not going to change overall, survival and things like that. So people should feel confident that they can go back and get good treatment still. But in my practice, because of the fact that we do a breast exam, it's kind of hard to do that virtually. We have moved some follow-up appointments to virtual visits. But for most patients that they're coming in to do their screening, we're trying to just make sure that they're patients who need to be seen at that annual basis. They're the cancer patients or the high-risk patients. And for some other people, we're trying to put them off a little bit, or we adjust our schedule a little bit to try to be a little safer for them, but without compromising their care.
And let's go back to that, because it was almost back to basics is, what do people need to be doing? I mean, the self-exam is one of them. Mm-hmm. Should they be going back? I mean, the primary care visits are starting to come back. People are going back to see their doctors, which is a great thing, but sometimes we are finding that people that let heart issues and things like that go a little too long and should have been seeing a doctor. What should people be doing now, preventative-wise and self-care-wise?
Well, I think the same thing.
Are we back to mammograms?
Yes, we're back to mammograms. We can still do the breast exams. You know, each provider is open to the extent. Some providers or primary care providers are back fully open, and some I know are still doing telehealth. So, you know, but it's important to go back to the mammogram once a year. It's important to still follow up on all of the care that needs to be taken care of. You know, people's heart issues, like you said, have to be, still be taken care of. Diabetes still has to be taken care of. All of the things that make people high risk for COVID really should be controlled and taken care of. So it's really important to keep in touch with your physician.
And can't underscore this enough, right? The earlier you catch that breast cancer disease, the better your odds are.
Yes, but if you were delayed during the COVID, there is no studies that's going to show that that's going to decrease your survival. Okay. So people who've said, oh my gosh, I didn't get my mammogram for 3 months, or I haven't seen my doctor in 3 months, it's okay. We have ways of treating that, and you'll be fine.
Okay, Dr. Mariscal, I mean, on the flip side of that, for men, prostate cancer, remind me what the age is. Oh, it's going to scare me. You probably shouldn't tell me what age it is. Today's my birthday, so, but thank you. Prostate cancer, when do you need to start getting the exam, and when should you start be thinking about that, and what do men need to be thinking about preventative-wise?
So that's kind of a debatable situation, because different guidelines say different things. But right. In general, you know, any man could get prostate cancer. That being said, most men who are going to get prostate cancer are going to be 50 and older. I do think it's a great idea to have a first screening at age 40. And then there's no upper limit of when someone can get prostate cancer. But not every prostate cancer is a prostate cancer that you necessarily need to treat immediately. Mm-hmm. And some of them we watch closely for several years before we ever get to a point where we may need to treat it. So those screening tests can be done, you know, even the PSA, it's a blood test. Mm-hmm. So, you know, some of that can be done virtually. And, you know, but definitely if we have a diagnosed aggressive prostate cancer, that's not going to be something that we're ever going to recommend holding off on treatment. But we do use medicine as part of the treatment, and we may bridge longer on that medicine if there was a reason that we're particularly concerned about a significant risk.
Are there other things other than breast cancer, prostate cancer, people need to be getting screened for, mm-hmm. taken care of, and what are the recommendations or the guidelines?
So all the things that we normally screen for, so colon cancer, you know, we are seeing, and we're very concerned that if people delay, especially if they're having symptoms like blood in their stool, that's not something that you want to sit on. And so we are concerned across the country that some of these things are getting delayed in that respect, where you have symptoms mm-hmm. that need to be looked into. So again, it's that balance of, do we need to do a colonoscopy? Maybe we can do, now we've got lots of other...
There's the FIT test, right, which is a
there's,
blood test.
There's a DNA test. There's several options that are non-invasive that you don't necessarily need to be in the office for. But definitely if you have symptoms, that's where I'd say absolutely we're not even looking at screening at that point. We're looking at what is the cause of this symptom. That should not be delayed.
So that's one of those things that you shouldn't delay care on.
Right.
What about lung cancer?
Well, again, so lung cancer, a lot of times there's no clear symptoms necessarily early on, but lung